Good day, everybody. Welcome to another episode of the MedTech Business Academy, sponsored by the MedTech Experts. My name is Skender Dairty. I am joined by my esteemed colleagues, Barbara Strain, Scott Alexander, and Mike Sperduti. Today, we're very excited to introduce our esteemed guest, Linda Lybert, who is going to talk to us about something that I don't think is at the top of mind for many people when they're talking about MedTech, yet she's going to tell us why it really needs to be. So, Linda, welcome to our podcast today.
Thank you. Happy to be here.
Thank you. So, Linda, in 30 seconds, just give us a brief overview. Who is Linda Lybert?
So, Linda Lybert has been an expert in the healthcare field for about 30 years, working primarily in the facilities side, so within healthcare facilities. And the area of expertise is surfaces. Surfaces, which is a foundational issue in healthcare, primarily around cleaning, disinfection, but for a lot of reasons. And people tend to overlook surfaces.
Is it fair to say, riveting question, is it fair to say, Linda, that you keep most conversations surface level?
Yes. No pun intended, right?
I'm done here. Yeah, thank you, everybody.
Oh, I like it better when I can control the microphones.
Sorry.
So Linda, what qualifies as a surface?
So everything qualifies as a surface. When you walk into a healthcare facility, the environment, and you look around a room, people look at chairs, they look at the floor, they look at the ceiling, they look at walls, but there's much more to that. They'll look at a medical device. And when you look at a medical device, you see a device, but in reality, when you look closely, it's typically more than one surface material. And by the way, you can't clean all of those surfaces the same way. And if you do, damage occurs and you create microbial reservoirs where microbes actually can embed themselves and proliferate. So it becomes many times almost impossible to clean and disinfect them and reduce patient risk.
Interesting.
So, Linda, what are the standards it seems like it's a complicated task to keep different surfaces clean. When somebody's producing a device, what are the standards that they need to adhere to?
That is a wonderful question. And I'm sad to say that there really are no standards. There are no guidelines, and there are no standards that say that you should adhere to a design protocol to support effective cleaning and disinfection.
So I'm under no obligation as a device manufacturer to make sure that my device does not infect anybody due to surface issues? That's
correct.
So the people that care about that, then it all falls on the hospital, or the environment is responsible for those infections, right, that take place. So they have to be concerned about it, right?
So in actuality, yes, that is true. Manufacturers design products and they create a document called an instruction for use, right? And they do, the FDA, for instance, will require, if you're going for a 510K clearance, they will require you to show that you can reduce microbes, it's called log reduction, in the testing process. So you grab a disinfectant, you show a reduction of logs, you pass 510K clearance, and you're good to go. And that is the biggest problem that we have. We really need to look at how's a medical device designed, what materials are we using, and can we actually use the standard disinfectants that are being used in a healthcare environment to clean it? And what's more, I'll go one step farther, is how many times is that device going to be cleaned in a day? I'll use a bed as an example. When you've got a patient in a bed, it's possible that bed may need to be cleaned up to 14 times in one day. Well, there's no testing requirements to validate that a healthcare professional could do that without causing damage to the bed. So hence, one of the reasons why HSI exists is to begin to address this issue. It's critical.
And I know this is an even bigger issue in like the monitoring equipment with their, LED screens and some of the material that they're made of. So how is a hospital disinfection program, infection prevention, EVS, how are they supposed to know exactly how to approach various monitors, et cetera, and understand how to account for that?
Well, the instructions for use that are created by the manufacturer will provide them with information based on what the manufacturer knows how to clean it. The problem is when you walk into a healthcare environment and you see 40, 50, 60 different types of pieces of equipment in a room, not all of them the IFUs do not match up. And oftentimes there are requirements for different types of disinfectants, and not all of those disinfectants are available to a person that's actually doing cleaning. And remember, it's not just EVS. You've got nurses, you've got a variety of people that are actually going to be cleaning that piece of equipment. So the challenge that we have is so many different kinds of equipment, so many different IFUs that aren't the same, and oftentimes can't be accessed. And what actually happens is whatever is on the cart, that's what's being used on those different monitors and different devices, and that can cause damage.
So because there are no standards, right? Why does anybody, until there are standards, will anybody care?
And you know what? I've had people that I've talked to specifically about that. In fact, encourage some of our medical device manufacturers to get involved in some of our work at the Institute. And they said they had no reason to. In fact, their fear is it's going to cost us more money if we actually, participate in this. If there are standards, now we're going to have to do different testing. And I want to say this: manufacturers spend a lot of money on testing their products. But they're not testing to validate cleanability. They're not testing for surface disinfection compatibility because it's not required. And you're right. Why would anybody do that unless they truly care? And there are companies out there that do. But again, there's a lot of information that they don't have and that they don't understand when it comes to writing an IFU, or when it comes to how many times is someone going to clean. And then comes to training all of the professionals that will clean their medical device to be sure that it's cleaned properly. So there's a lot of aspects to this problem.
So Barbara, I know that you're close to this. I guess this is not just a disinfection problem. This is also a surface and device integrity problem, longevity aspect. How long can the device be used if it's not cleaned properly beyond just disinfection? So what's been your experience, Barbara, and what thoughts do you have on that?
So a personal note before I get started on the question is I've known Linda for 4 or 5 years. We work together at the Institute and part of the advisory council, and we do a lot of great work, and I'm really happy to have Linda on to spread this message. So to answer your question, a lot of it really goes all the way back into the design phase of the medical device and testing all the way through that design phase. And it's a real issue, and you pointed out it was that lifetime of the device. And what we saw in value analysis when I was working in hospitals is Biomed would call us, or the nurse or whomever in a department would call us and say, I can't read the dials. We don't have any way of functioning the equipment. We've got cracks in the bezel, or what's called the front of an IV pump or whatever. And this may have been only after a few months or so. And so come to find out, they not following the IFU and not using the right disinfectant caused those issues. But I'm going to throw this back to Linda a little bit. Is Linda and I helped co-author between AVAP and HSI a great case study, and based on anonymity for the folks that were involved, there was a real hospital and a real manufacturer who cooperated, and we got every piece of data, everything over the longevity of this case study. And Linda, why don't you elaborate on what that really shows and where people can find and read that case study?
Sure. Thanks, Barbara. The case study is actually available on the Healthcare Services Institute website under resources, and it's case study. And what we did is there was a medical device that came into the healthcare facility that had an expected life cycle of 5 years. And within 2 years, they were seeing significant damage. So we did a very deep dive. And we looked at the IFU, and one of the things, that's it. One of the things that we discovered was that in the 510K FDA testing, they used a disinfectant that the hospital actually wouldn't allow to be used in their patient care areas. And what ended up happening was that they had to make a decision, and the hospital had to go through a risk assessment and determine what disinfectant they would use. And what actually ended up happening was the disinfectant that they chose was in a very fine print with a little asterisk at the bottom of the IFU page that it was incompatible with some of the components of that medical device. So there was a lack of information. There was also a challenge around the professionals that were referencing the IFU. And so the manufacturer actually created a one-page document that made it a little easier for them to review. We found communication errors within the healthcare facility, and not errors. It was a lack of communication because the manufacturer enters the healthcare facility and talks to many different people, but the facility didn't get together and talk about the challenges that each one of them had. And so those were just a couple of them that were really, high level. You need one point of contact when you're a manufacturer, so you can have that IFU communication around, and training. And I think those were the top ones, right, Barbara? Were there more that I might have missed?
I think those are key for this audience, yeah.
So I have a question, Barbara. I'm going to pin it to you first, and then Linda, you can follow. And Barbara, the reason that I'm asking you is because from a value analysis perspective, right? Am I rewarded as a medical device manufacturer if I went and I did the best job, right? And I told you how to clean my equipment, with what stuff to clean it with, and I gave you the life cycle and the whole thing, and I did totally the right thing, and I provided that to you. Am I rewarded over another device that doesn't take that step?
All of those things that you said are on our checklist for value analysis. And we work closely with infection prevention and control at our institutions, and they're usually part of this process. So we would have had everybody in the room talking about it. And if our final designation was we could follow everything, it was clear, we investigated, then yes, is the answer to your question.
Fantastic. So even though there's no standards from a governing body, each hospital, if they have those standards, every hospital should have those standards.
Well, the thing of it is that everybody is in the same dark room currently when it comes to the standards, because there is a lot of misconception about, well, I followed the standards, therefore everything that I'm telling you should be correct from the manufacturer. And what HSI, and Linda's going to tell you, is what we're all about in making sure everybody understands that they don't know every single piece.
And so the other component to this is the fact that healthcare facilities are often limited to the amount of time that they can take to effectively clean and disinfect medical devices and rooms. And in some cases, one of my favorite pictures I use in slide presentations is an emergency room, where obviously there was probably a stabbing or something. And this room, because the first thing they'll do is take care of the patient, right? Focus is on the patient. And so when you look at this room after they're done treating this patient, there is blood splattered and other body fluids everywhere. For an EVS professional, They are asked to turn that room around in 15 minutes. The other part of this picture is how many different devices are in that room and were used for care on that patient. And so regulatory agencies are now saying you have to follow the instructions for use to clean every medical device in this room. And oh, by the way, you have 20 minutes to turn it over and make sure you follow the IFUs. That is impossible. And I'm not one that says something is impossible, but that is absolutely impossible. And if they don't follow the IFUs, they can be fined by the regulatory agencies. And one of our professionals that I personally know, that fine for one medical device, $10,000. So now the hospitals are taking a hit, not only for not following an IFU and the fact that they have to turn these rooms over quickly, and always a potential for a patient to acquire an infection. And so there is a lot to this issue that really needs to be addressed. And that's what we're doing.
So I've heard of two different ways that potentially people are addressing this issue from a third party perspective. Okay, so are there companies, and I've heard of companies that have sort of like a light therapy or some sort of situation where a light goes off or there's some technology that clears all the infection off of these devices? And then I've also heard of companies that have material built into their technology that makes them infection free. Are those real things that exist today, or are they just things that people are making up?
So I can answer that very easily. What you're talking about is UV disinfection, so ultraviolet light. And there are pieces of this disinfection process where you actually put the device into what is a small room or container, and then it's hit with the light. UV light is line of sight only. And some of these devices have lights all the way around, but you also have to manually clean the product before you hit it with the UV disinfection. It does not clean unless it is manually cleaned first. And the other concern is that there has been no research to show whether or not, we do know that the UV light causes damage. We don't know when and how soon. So there's a lot of research that needs to be done there as well. But we have had hospitals report damage as a result of using the UV light. The other thing you've been talking about, you brought up, was antimicrobial surfaces. And antimicrobial surfaces, there's a variety of them, and they are on the market. And yes, they can be effective. But if you do not clean the device first, so let's say you've got a antimicrobial product embedded in the surface, not just a film, but embedded in the surface, and you don't keep that clean, bioburden accumulates on the surfaces and eventually will render that antimicrobial product totally ineffective because it's covered up from bioburden. So no matter what you look at, you're going to have to manually clean it before those things are effective. And the other thing around antimicrobial, and we aren't going to throw the baby out with the bath here, but antimicrobial products are of concern and an issue because of antimicrobial resistance. You hear a lot about hospitals all have an antimicrobial resistance stewardship program because the overuse of an antimicrobial or antibiotic can render, again, those products ineffective because the microbes have built a resistance to it and they've gotten stronger. So the use of the antimicrobial products should be strategic. You should use them, in a way that will help with the cleaning and disinfection. So I look at cleaning and disinfection as multimodal. There's not one silver bullet that's going to take care of it. But if you look strategically at all of the different technologies that exist and design products for cleaning and disinfection, we're going to start seeing solutions.
So where does a company start? Like if let's say that and is maybe that even the audience that should be leaning in, but like, where does this process start?
It really starts with design. It really does. And the selection of surface materials. And the surface materials should be selected so that they can be cleaned easily and disinfected. So I love to pick on the brushed stainless steel as an example, because it looks nice, right? It's not the shiny clean, but when you brush that surface material, you've created microbial reservoirs. And microbes we can't see. So they can easily attach. And microbes actually seek out a place where they can attach to a surface. So if you keep that in mind and know that the microbes are going to seek a place to attach, and you start looking at the materials that you want to use to design with, and then start looking at ways that you can design something so that you can use the common disinfectants that are used, you've got a great start. Literally, that's where you need to start.
Is there any statistics on the scope of this problem, like how much of this is contributing to infection rates?
I know there's certain areas like mattresses I know are a big issue, but are there sort of worst offenders kind of a thing?
Well, and herein lies why HSI exists.
Yep.
This is an issue that has been overlooked completely. Interestingly enough, there are ways, in fact, if an outbreak happens in a hospital, they are able to track where that outbreak started and be able to, one, for instance, is of lead wires on an EKG machine. They can actually find out where it started. But, from there, we have to start dealing with the materials and the design and selecting things that can be cleaned and disinfected.
Barbara, you've referenced Linda, you've referenced the Institute a few times. And just for clarity for the audience's purposes, we're talking about the Healthcare Services Institute, HSI, which is now part of the ISSA family. So Linda, could you just share with us, what is HSI's mission?
So I would have to read exactly what our mission is, because
we don't need the mission statement, just overall. Okay. What is the mission?
Yeah, our mission is to call attention to the surfaces that are in the healthcare setting and the fact that it is nearly impossible to effectively clean and disinfect different areas of the hospital, because surfaces is a critical foundational issue. We look at the three ways microbe moves: air, water, and surfaces. We have regulations around air and water. We have nothing around surfaces. And until we start setting guidelines, and, we're working on a program that has tools such as checklists and things like that of what questions should you ask when you're considering purchasing a product. And the questions include what materials it made of, what are the disinfectants that you can't use on them, looking at seams and all of those types of things. And that's what our mission is, to call attention to it. We are currently working on developing testing and validation, the certification program. We've written one test method. It is patent pending right now. And that is around the raw material and testing them for the use of different disinfectants and when does damage truly occur. And then we're working on one for assemblies, which will be part of the medical devices. But this is really questions that healthcare facilities have asked us to help them make a determination on: how do we select these materials and these devices? What do we really need to ask? And then what's some of the data that we need from our manufacturers to get a better understanding? On the manufacturer side, understanding how many different people will be doing cleaning and disinfection, and then understanding, for us, it's difficult in a 20-minute time period to effectively clean and disinfect rooms. And that's not something the hospital decided on. That has to do with the Accountable Care Act and how quickly people move throughout the hospital and some of those requirements. But our mission is to support and empower healthcare professionals in evaluating products and surface materials and look at the environments, the care environments that they will be used in, the design of the product, the way that the cleaning is required to be done.
So outside of just having to file an IFU, where does the FDA get involved here?
Well, if you need 510(k) clearance, for instance, the FDA does get involved because you have to go through their testing. Mm-hmm. But even their guidelines are very confusing. So we referenced the medical device that went through 510(k) clearance, and they weren't given any guidelines around testing. Well, just use one disinfectant is fine. Show log reduction, we're good. Again, it's a lack of knowledge from the FDA standpoint as well, and not being able to help support the manufacturer. Now, this medical device manufacturer actually went through some testing, both in-house in their own laboratory, but also through the FDA, and they had no guidance as to what disinfectants should we use, how many of them should we use, and so they ended up spending a lot more money on testing once they discovered the issue.
Well, we appreciate you sharing. I think we're approaching the top of our time here, and we're going to give you a chance to get the final say here, Linda, with what you'd like to leave the audience with. With that, I'm going to give each of the panelists an opportunity to either ask one last question or impart one thing that a parting shot that they've remembered from this call. So, Barbara, why don't you start us off?
So I think what the thing we want to leave with the audience is it's not just the environmental services folks that are cleaning. It's really not their problem. They're the last person in line doing some, terminal cleaning of rooms. But if all of the processes way before them, whether it was design, the final testing, the education of infection prevention and control, hospitals, everything down the line, then we have the success of the environmental services folks at the end, and the whole loop will be closed. So keep tuned and get on and learn as much as you can.
Continuum. Mm-hmm. Continuum. Makes sense. Henny Youngman or Scott Alexander?
Yeah, I think thanks, man. I think about my time at on the provider side, and the reality is hospital-acquired infections are a big deal. I mean, there's 100,000 people that die from an infection every year that was acquired in a hospital, and a significant percentage of those come from surfaces. So from the provider side, this is something that's really important that I would want to see if I was sitting in an value analysis committee or back in my previous role. And then I think about it from a manufacturer standpoint. I see this as a big opportunity to establish myself with a competitive advantage, right? So it's a big deal. Wouldn't it be cool if we could help this, big problem that you have, saying somewhere, drop in its impact because of the impact that we have? Like, I think that this is such low-hanging fruit, particularly when we're thinking about a lot of the materials and things that you're talking about, Linda, are already well known, right? It's, having been a product manager, like, there's only so many different things we can make our devices out of. So it's not like you're having to invent new science to do what you're describing. It's more about using best practice, which ultimately helps everybody. But I think this is one of those things where hopefully it becomes a bigger deal. I hope it bubbles up to the surface. And see, I'm good for two. But I think in all seriousness, it's as important to be able to focus in on.
To tip your waiters.
Exactly. I'll be here all week. Yeah.
Mike, how about you?
So I'm just shocked at the fact that there are no standards at all. I mean, it's shocking considering the fact of the infection problem and how many people either die or their illness gets elongated because of an infection. So hopefully we'll see some movement there just with the exposure of things like this and conversations like this, number one. Number two is, just putting my business hat on right now and the opportunity hat is, I'd love to know, Linda, like, what are the devices that are reeking with problems, right? Because if I could identify with those devices and then I could re-engineer those devices that would be more friendly to not producing infections, that'd be a huge opportunity. So as Scott said, I look at this as a business person as a huge opportunity to innovate and differentiate and win.
Yeah, thanks, Mike. And Linda, I want to thank you. I'm going to turn it to you for the last say on this, but we do appreciate your time, first and foremost, for joining us today and really drawing awareness to something that I think it needs greater attention and knowledge around it. I think the misnomer is so many people view the hospital room as being just fairly sterile, right? And we overlook those aspects that it is not sterile. And oftentimes the EVS cart, the nurse walks around with the same bottle of ammonia or whatever the cleaning agent is, and as you're saying, it is variable. It is totally variable as to how those cleanings should be provided, etc. And I don't think that's something that is common. And so we thank you for drawing awareness to that, and hopefully as you continue to grow within ISSA and all the new resources available, we hope that the attention continues to grow. So thank you again, Linda. Appreciate it. With that, we turn to you for the final word.
Thank you. This has been great. I would like to invite everybody to go to our website, download that case study, which is really awesome. And I also want to let you know that we have a summit that's coming up April 7th and 8th. And it's not one of those sit in a room and listen to us talk. It is an actually roll up your sleeves and work with us. And that's April 7th and 8th. It's the Healthcare Services Summit. And we would love to have some medical device manufacturers join us as we move forward to tackle this issue. And that's my final word.
Yeah, thank you very much. The information's up there. We encourage everybody to please reach out to Linda if you have any questions, if you have any thoughts. MedTexperts, we encourage everybody to please get in touch and learn more about how we can be proactive in this. There's no reason why those services need to be infested the way they are. So if we all act now, we can find ways to resolve the situation. So once again, Linda, thank you. MedTexperts, thank you for joining. And audience members, thank you very much for joining. We appreciate it. And we look forward to seeing you on another episode in the near future.